No one knows the pain and anguish of an amputation better than James Andre. That's why after losing his left leg to vascular disease, the thought of losing his right was unbearable.
He came in with a lot of tears in his eyes, saying that if you can't help me, I just don't want to live anymore.
I would never go through another amputation. The pain is so terrible, it's inhumane.
The energy expenditure after you get an amputation, especially an above-knee amputation, is significant. And a lot of these people have cardiac conditions and pulmonary conditions, so the amount of energy that they have to use is in low reserve.
But despite the challenges, Andre had been making good progress with the prosthesis he got from Dr. Breinsma at Mary Freebed Rehabilitation Hospital, until the pain in his right leg got worse. That's when he sought out Metro Heart and Vascular.
Dr. Mustafa walked in the office, looked at my foot. First word out of his mouth wasn't hello, it was, you're going to lose that. He says, and I can save that.
They did the surgery and he came in and he said, your leg is safe now. I mean, that was a good day. That was wonderful news.
When I saw him before that procedure, he was down in the dumps again, as he thought he was going to lose the other limb, and if he lost that limb, I think he understood that he was not going to be walking again. And then I think the next time I saw him, he was on cloud 9, and his foot went from being purplish with poor vascular supply to being healthy, white tissue.
We found that he has a very faint Doppler flow in his foot, which told me that there is some blood getting there, but not enough, which gave us the idea that we can go and connect that with the rest of the leg. And that is exactly what we did.
Because of a recent bypass surgery in the femoral artery, Dr. Mustafa went in through the foot with a series of balloons and stents that restored blood flow to the lower leg.
Most patients that end up agreeing to have an amputation is because of the excruciating pain that they live through. Just toward the end of the procedure, even before we finished, he expressed that his pain just went away and his foot feels warm.
Like Dr. Mustafa's kind of helped us hang on to that hope, and that's been really an important part of getting better.
Hope is huge. When someone is fighting a lot of chronic illnesses, their mortality rate with an amputation is incredibly high. So if we can prevent an amputation, we can really give someone their life back.
He's able to move around and get around, and his body's just better because of the exercise. You're moving.
The walking that Dr. Mustafa told me to do evidently is helping my circulation. You get so down when things don't get better. Any little hope you get, you grab for.
One step at a time.
Yeah, that's right.
Listen to what patients are telling you. There are some very simple screening tools that can be done to screen patients for peripheral vascular disease. Never give up. You can't say there isn't anything that can be done. That isn't true anymore.